A recent black box warning for Avandia has resulted in a FDA-mandated risk evaluation and mitigation strategy program. Both prescribers and patients must enroll in the Avandia rosiglitazone medicine access program in order to be able to access rosiglitazone's medicine. Since November 18, 2011, patients are no longer able to obtain their Avandia from their local pharmacies, but have to receive it by mail from one of the specially certified pharmacies participating in the rosiglitazone REMS program. Patients already taking Avandia who have been advised by a healthcare professional of the risks and benefits of Avandia, including the potential increased risk of myocardial infarction, or patients not already taking Avandia who are unable to achieve adequate glycemic control on other diabetes medications and have been advised of the risks and benefits of Avandia, including the potential increased risk of myocardial infarction, and in consultation with their healthcare provider, have decided not to take pioglitazone, the brand name Actos, for medical reasons. This black box warning came as a result of a meta-analysis of 52 clinical trials, included almost 17,000 patients, most of which compared Avandia to placebo, and showed that Avandia was associated with a statistically significant increased risk of myocardial infarction. 3 other trials that included nearly 14,000 patients compared Avandia to other approved oral antidiabetic agents or placebo, showed a statistically non-significant increased risk of myocardial infarction and a statistically non-significant decreased risk of death. There have been no clinical trials directly comparing cardiovascular risk of Avandia and Actos, but in a separate trial, Actos, when compared to placebo, did not show an increased risk of myocardial infarction or death. Unfortunately, Actos has its own safety concerns. The FDA has recently released a warning of increased risk of bladder cancer for those patients in particular who have had the longest exposure to Actos and those exposed to the highest cumulative dose of Actos over their lifetime. This has now resulted in a contraindication in patients with active bladder cancer, a history of bladder cancer, or with uninvestigated macroscopic hematuria. The FDA is also aware of a recent epidemiological study conducted in France which suggests an increased risk of bladder cancer with Actos. Based on the results of this study, France has suspended the use of Actos, and Germany has recommended not to start Actos in new patients. Meridian assembled an interdisciplinary team of healthcare professionals to assess current evidence in the management of diabetes. This team examined content from the American Association of Clinical Endocrinologists, the American Diabetes Association, and the American Dietetic Association. An AHRQ, comparative effectiveness of diabetic pharmacologic agents, was also reviewed. The end result was a guideline summary and practical guide. The practical guide summarizes the benefits and risks by drug type. For example, the percentage of hemoglobin A1C per agent type is shared and the concerns for weight gain are classified. Everyday considerations such as usual dosing, time to achieve response, and expense are itemized. This document is available on the Physician Extranet for broad availability. Further, a webinar on current evidence in the pharmacologic management of diabetes is recorded for wide dissemination. We hope that all clinicians will take advantage of these offerings to help improve diabetes care.